At Jacobi Medical Center in the Bronx, health professionals and community members alike are teaming up to combat gun violence as if it were an infectious disease. Dr. Noe Romo is the director of Pediatric Inpatient Services at the hospital. He also serves as the medical director for the program's Stand Up to Violence initiative.
We are essentially hiring outreach workers from the community coming from neighborhoods where violence has very high prevalence and using them as essentially mentors to mentor patients in the hospital when they come in to try to prevent retaliation, counsel against re-injury, and figure out the factors that led to their injury.
Growing up in East Los Angeles exposed Dr. Romo to the effects of gun violence at an early age, which had a significant impact on his career trajectory after moving to the East Coast.
I think at a very early age, I was able to recognize that reality, and that really helped formulate what then I ended up seeing clinically. When I came back east to the Bronx in medical school, I went to Albert Einstein College of Medicine, where I rotated through hospitals in the Bronx. I did my residency here at Jacobi, and us being a level 1 trauma center here, I found myself being on the other end of the interaction as far as violent trauma, and then now I was a physician taking care of the patients who were injured, either shot, stabbed, or assaulted, as opposed to being the family member or the community member who had been either witness or had experienced that same violent trauma.
With the creation of the Stand Up to Violence program in 2014, Dr. Romo and his fellow program members aim to identify high-risk individuals and prevent retaliation in the hopes that it will keep gun violence from spreading across the communities they serve. Stand Up to Violence currently works within 3 different precincts in the Bronx. In those areas, shooting injuries have dropped more than 40%.
So essentially, patients that we see are less likely to get re-injured and are more likely to be more adherent to their medical care. And in the community, we're seeing significant decreases in the violence that we used to see.
While Dr. Romo is proud of the success of the program, he says there is still work to be done as long as community members continue to suffer from violence-related injuries. I'm Sabrina Boyd in collaboration with BronxNet.